ሰላም ጤና ይስጥልኝ እንደምን አላችሁ አልፋለም ነኝ ከፕራይም አልፋ ቱቶሪያልስ በዛሬ ቪዲዮዬ በፋርማኮሎጂ ሌክቸር 1 ላይ ባየናቸው ቶፒኮች ላይ ወይም ደግሞ ቤዚክስ ኢን ፋርማኮሎጂ የባየናቸው ላይ question and answer ሴሽን እንዲኖረን ነው 10 ጥያቄዎችን አዘጋጅቻለሁ እነዚህን ጥያቄዎች አብረን እያየን የምንመልሳቸው ይሆናል ማለት ነው So, እንዳየነው ባለፈው ዕለት common terminologies እና source of pharmaceuticals ብለን አይተናል. So, እሱን እንጀምራለን. So, the first question is ከterminology ጋር የተያዘ ነው. Which of the following best describes pharmacology ይላል? Which of the following best describes pharmacology? A is the study of ancient Greek medicine practice. B is the study of substances that interact with non-living biological systems. C is the study of substances that interact with living biological systems through chemical processes. D is the study of substances that have no impact on biological functions. So, መልሱ ምንድነው? The answer is C, right? Because pharmacology, yes, it is the study of substances that interact with a living biological system. Kalabezia, living kalwana, PKPD ምንለው concept አይኖርም ማለት ነው. So, interaction is through chemical processes that drug እና receptor interact የሚያደርጉበት ማለት ነው. So, the answer is C. Okay, I think in the agate መልስታላችሁ. Let's continue. ቀስ እያልን ጠንከር ያሉትንም እንሞክራለን. So, the second question is which branch of pharmacology deals with the undesirable effects of chemicals on living systems, from individual cells to human to complex ecosystem. So the main question is undesirable effects. A, pharmacokinetics. B, toxicology. C, pharmacodynamics. D, pharmacogenetics. So what is the answer? Branch of pharmacology which deals with undesirable effects. Yes, the answer is B. Toxicology. Toxicology studies about the undesirable effect of a specific drug or its effect impacting individual cells to human and the complex ecosystem. Right. መጨረሻ ላይ ከ10 ስንት እንዳመጣችሁ እንግዲህ ኮሜንት ላይ ትጽፉልኛላችሁ. All right, let's get to the third question. The third question says, again, terminology. Which term best describes a substance that is foreign to the human body? Manalan, that is foreign to the human body. A, endobiotic. B, xenobiotic. C, autobiotic. D, homobiotic. ተመሳሰለባቸው አይደል ቃላቶቹ ተመሳሳይ ይመስላሉ ግን they completely different በጣም የተለያዩ ተርሞች ናቸው so what is the answer? The answer is B. B is the answer. B ካላችሁ እንግዲህ congratulations. B is the answer. Xenobiotic. The term xenobiotic derived from the term the Greek term xenos, right? Xenos ማለት stranger ማለት ነው ብለን አይተናል. So if you say xenobiotic, you are right. So let's continue to the fourth question. The fourth question says, what term describes an inactive form of a drug that requires metabolic activation inside the body to release the active form of the drug which then exerts its pharmacological effect. An active form of what? Drug. That is the main question. So choice A says prebiotic. Choice B, probiotic. Choice C, prodrug. Choice D, postbiotic. So inactive form. Stay also inactive form. So this inactive form requires metabolic activation, scaffolding, active drug or drug እንዲለይ የሚያደርግ biological system ሲገባ metabolic activation የሚፈልግ ካልን what is that? It is prodrug. The answer is C. ስለዚህ C ካላችሁ ጎበዝ. Let's continue. All right. It is becoming ጠንከር እያለ ነው. All right. Let's get to the fifth question. It says, which term refers to the component of a cell or organism that interact with the drug, initiating a chain of biochemical events leading to the drug observed effects? A, pharmacodynamics. B, receptor. C, pharmacokinetics. D, prodrug. ቀላል ጥያቄ ነው። I think የመጀመሪያ question ላይ relatable ስለሆነ ሳንመልሰው አልቀረም። So the answer is B, right? The answer is B. So a drug to exert its drug action, it should interact with a receptor, right? So this drug receptor interaction is chemical reaction or chemical process, and this chemical process ምን አለው? biochemical events አሉ, cascades of reactions ይኖሩታል. Then the drug response or drugs observed effect ማየት እንችላለን. So the answer is B. All right, let's continue to the next question. Question number 6. Question number 6 says, in pharmacology, which term specifically refers to the actions of a drug on the human body? The actions of the drug on the body, determine its effectiveness in treating a particular disease or symptom. So now the power is የማን ነው? የድራጉ። So A, pharmacokinetics. B, therapeutic index. C, pharmacodynamics. D, drug metabolism. So the answer is if the drug is in power, the answer is C, pharmacodynamics. ስንት አገኛችሁ? ከ6 ስንት አገኛችሁ? I hope ሁሉንም 6ቱንም አግኝታችኋል ብዬ አስባለሁ, because these are very 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 simple questions እና 6ቱንም አግኝታችኋል ብዬ አስባለሁ. All right, let's continue. Number 7. In pharmacology, which term specifically refers to the study of how the human body processes a drug over time, including its absorption, distribution, metabolism, and excretion property? A, pharmacodynamics. B, drug pharmacokinetics. C, therapeutic index. D, drug metabolism. So the answer is now the human body is empowered. It can manipulate, it can diminish or enhance the effect of the drug by using its different processes, the ADME processes. So the answer is B, right? The answer is B. Because we are talking about drug, we can use the term drug, even though the actual definition is pharmacokinetics. ስለዚህ the answer is B, which is drug pharmacokinetics. All right, let's go to the number 8. Number 8 says, which of the following terms refers to the study of genetic variations among humans that result in differences in pharmacodynamics and pharmacokinetics, leading to individual variability in drug response? በሌክቸር ዋን ላይ ስናወራ እንዳለው genetic variation can affect the drug response, right? So ይህን የሚያጠና ሳይንስ ምን እንለዋለን? or branch of pharmacology? A, pharmacoeconomics. B, pharmacognosy. C, pharmacovigilance. D, pharmacokinetics. E, pharmacogenomics. የትኛው ነው? I think ከተርሙ ገስ ማድረግ ትችላላችሁ, right? So the answer is E, pharmacogenomics, right? So pharmacogenomics studies any genetic variation which can lead to individual variability by affecting the PK/PD of that specific drug, resulting in a different drug response. All right. We are doing great. ሁለት questions ይቀሩናል። የሚቀጥሉትን questions properly ከመለስን all right. So question number 9 and 10 ትንሽዬ እንደዚህ ያሉ ናቸው. So let's try to read them carefully. So question number 9 says, which of the following statements accurately distinguishes between pharmacogenomics and pharmacogenetics in the study of genetic factors affecting drug response? It's related with question number 8, but now we're focusing on a more detailed version of the branch. So A, pharmacogenomics focuses on the broader genomic context and interaction that influence individual variability in drug response, while pharmacogenetics specifically examines the entire genome's impact on pharmacological outcomes. እንዴት ነው? All right. B, pharmacogenetics encompasses the study of specific genes and their variants in drug response, whereas pharmacogenomics solely considers the overall impact of genetic factors on drug metabolism. All right. ተመሳሳይ ይመስላል አይደል? Let's continue. C, pharmacogenomics delves into the role of specific genes and their variants in drug response, while pharmacogenetics focuses on the broader genomic context and interactions influencing individual variability in drug response. D, pharmacogenetics investigates the entire genome's impact on pharmacological outcomes, while pharmacogenomics specifically examines the role of a specific gene in drug metabolism and efficacy. A, pharmacogenomics and pharmacogenetics are interchangeable terms that both refers to the study of genetic factors affecting drug response without any distinction in focus or scope. So somewhat the question, because ረዘም ያለ ምርጫ ስለሆነ ቻሌንጂንግ ሊሆን ይችላል። however immediately እንኳን ባትመልሱት ደጋግማችሁ አይታችሁ ይሄን question እንመልሳለን። so እንትኖቹ ረስታችኋቸዋል ኤና ቢ። so the answer is A. The answer is A. ምንድን ነው የሚለው? pharmacogenomics focuses on the broader genomic context and interactions that influence individual variability in drug response. ያኛው ግን the genetics part, pharmacogenetics specifically examines the entire genome impact on pharmacological outcome. ስለዚህ more of the focus vary ያደርጋል. The focus ቫሪ ያደርጋል። ስለዚህ genomics ካልን maybe individual variability based on the genome context ልናወራ እንችላለን። pharmacogenetics ካልን ግን የአንድ specific entire genome impact on pharmacological outcome. So somewhat ተቀራራቢ ይመስላሉ፣ interchangeable ይመስላሉ፣ ግን the difference is evident. So let's continue to the number 10. Number 10 says, which of the following statements accurately distinguishes between pharmaceuticals derived from natural sources and synthetic derivatives in terms of their impact on drug response? So there's this source of pharmaceuticals ላይ ሁለት branch አለ ያልነውን እሱን question ነው። Since this is the last question, let's dive into the choices. A, it says natural pharmaceuticals primarily target specific genetic variants to enhance drug efficacy, while synthetic derivatives focus on broader genome interaction to influence individual variability in drug response. It's not that much related. genome related. B, natural pharmaceuticals are more likely to exhibit unpredictable side effects due to their complex molecular structures, while synthetic derivatives are designed to have a more targeted and predictable impact on drug metabolism. That's correct because natural pharmaceuticals or natural sources are more of crude extracts, and they lack standardization, right? So የተለያዩ compounds mixture ሊሆን ይችላል። So taking that as a whole, maybe a factor which leads to unpredictable side effect ማለት ነው። synthetic ሲሆን ግን either በcombinatory chemistry ወይም ደግሞ specific structure activity relationship ተሰርቶላቸው የሚወጡ ስለሆኑ they do have predictable pharmacokinetics profile ማለት ነው። So B is okay. C, synthetic derivatives are known for their higher bioavailability and faster onset of action compared to natural pharmaceuticals, which may have slower absorption rates and longer half-life. It's very difficult to conclude based on classification. Natural no synthetic no ብለን እንደዛ decide ማድረግ አንችልም. It can vary from drug to drug. ስለዚህ ይሄኛው is not right. D, it says natural pharmaceuticals are less susceptible to drug-drug interactions and adverse effects compared to synthetic, which often require careful monitoring. Those are just based on individual genetic factor. It's not that much related with genetic factors. However, natural pharmaceuticals are prone to interactions or more adverse effects due to lack of standardization, right? E, says natural pharmaceuticals are typically more cost-effective and environmental sustainable than synthetic derivatives, which often involve complex chemical synthesis process and resource intensive production method. Almost ተመሳሳይ ፕሮሰስ ነው ያላቸው ናቹራል ቢሆን ሲንተቲክም ቢሆን that much ቫሪ የሚያደርግ አይነት እንትንም የለውም። እንዲሁም ናቹራሎቹ ከስታንዳርዳይዜሽን ጋር ተያይዞ ብዙ ፕሮሰስ ሊፈልጉ ይችላሉ። ሰው ከዚህ ውስጥ I hope ከ8 እስከ 9 ከመለሳችሁ ጎበዞች። However, question number 9 somewhat በሌክቸር 1 ካየናት ትንሽዬ ቫሪ ታደርጋለች። So እሷ question ላይ በሌላ ቶፒክ ስለምመለስ ብዙ አትጨነቁ። We will discuss in details what differences pharmacogenomics and pharmacogenetics really have. እና በደንብ በዲቴል compare and contrast እያደረግን የምናይበት ጊዜ ይመጣል። So ጨርሻለሁ። questionችን ጨርሻለሁ። በጣም ነው የማመሰግነው። ለጓደኞቻችሁ ሼር አድርጓቸው፣ እነሱም ቪዲዮ አይተው ይማሩበት። በሌላ ቪዲዮ እስከምንገናኝ በሌክቸር 2 እንገናኛለን። ሲሚላር ፓተርን ከሌክቸር 2 በኋላም ደግሞ እንደዚህ questionዎች አዘጋጅቼ ወደ እናንተ እመጣለሁ። I hope ይሄ ቪዲዮ እንደተጠቀማችሁ ሼር አድርጉት፣ ላይክ አድርጉት። any question ኮሜንት ካላችሁ ጻፉልኝ። Thank you. Bye.